and good afternoon.
Depends on where you are in the world, where your butt is sitting.
Exactly, guys. We are here in Tampa, Florida at Colovan, America. This is Dr. Shiraz Farooq, DaBootyDoc, and Sydney Farooq, my spouse.
Good to see you guys this evening. Welcome back. We had a lapse last week. We had an important event going on, so we weren't able to record the show. So hopefully you missed us.
We are here today, and we are happy to report that things are great. And we wanted to talk to you today about a very important topic.
Maybe you know about it.
Maybe not, but we thought we will educate you about that.
And if you haven't joined us before, it's your first time, this is the DaBootyDoc Talk. So we're doing a show to educate our patients and family members and friends about different diseases, different information about the colon, the gut, healthy eating. So we're simply here just to give you that, kind of conversational talk, easy flow. If you have questions, submit them during the show. We can see as you guys log in, and we'll be happy to answer some things.
Thank you very much, guys. This is a informational and educational entertainment show for you guys, where we may make some jokes also. Some of these jokes are kind of fun. At least we think so. So I hope you guys laugh with us. This is a talk about butts, guts, and nuts. So here we are, the booty talk.
So what's our topic today, Dr. Farooq?
The topic we are going to talk about is very common. It is called diverticulosis and diverticular disease and diverticulitis. Sounds like a lot of words, yeah?
Sounds jam-packed.
Jam-packed, I would say so. Diverticular disease basically means that you don't drop your pen. No, actually, diverticular disease is a name given to pockets in the colon that get infected and cause problems.
Pockets. This sounds kind of gross.
Well, pockets or pouches.
Okay.
What happens is that in the colon, as we grow up and we get older, our colons develop some pockets and outpouching and some extra spaces. And these extra pockets are like extra pockets in your pants, and
Now are they bulging out?
They're bulging out.
Or in?
They're bulging out.
Okay.
So they bulge out of the colon, and that causes problems.
Now, is it in my whole gut? A specific area in my gut?
So it's in the colon only. Diverticulosis is just the development of pockets. So when we are talking about diverticular disease of the colon, we are only talking about the colonic polyps, colonic pouches and pockets, not in the other parts of the gut. So you can get pockets in the other parts of the gut, but that's another topic.
Okay.
Another disease, another topic.
Okay. So specifically bulging pockets in my colon.
In your colon, in my colon, and Americans all over can have these pockets, and these pockets can cause problems. And there are millions of Americans who have symptoms of diverticular disease.
Which are?
I was queuing you up to that. So diverticular disease is basically just the presence of these pockets, which is called diverticulosis. So when you have the words OSIS after a fancy Latin word like diverticulosis, that means that these pockets are just present.
Okay, so they're not causing me problems maybe, or?
They may not be causing you serious problems, and when they start to cause you serious problems, medical problems, they are called diverticulitis, itis. So example of that is laryngitis, pharyngitis, appendicitis, cholecystitis. Itis after anything means infection and serious problems. So you might have heard, itis being used by a lot of people in layman terminology also. Oh, they got
the itis.
The senioritis is a word we use.
Our daughter has that.
Yes, our daughter is in.
She has a disease.
Oh no, she doesn't have a disease. She's in high school. High school itis is senioritis, and when they're in the last class, they become bossy and they don't want to listen to you.
No, so it's when they don't want to go to school anymore or work hard.
I see. Yes. That's senioritis.
Okay. She's just bossy and doesn't want to listen to you.
So that's called bossitis. anyway, diverticulitis is when these pockets get infected, and by definition, here's the scientific words, okay? By definition, diverticulitis means that there is a micro perforation, a tiny little hole, and some poop and some bacteria are leaking out of your intestines into your abdominal cavity.
So the pockets actually are seeping.
They are seeping and they are pooping and they are leaking. They are leaking some poop and some infection and bacteria.
That sucks.
It's horrible, and that sucks for a lot of our patients. A lot of people, when they get that, they start to develop abdominal pain, bloating, extra gas. They may have discomfort on the left side mostly, or the right side sometimes, and then they can get very, very sick also.
So, say I have a regular colonoscopy. I'm told that I have diverticulosis.
Okay.
So I'm not, maybe I didn't even notice the symptoms or realize. So should I be very concerned? Is this something that is certainly going to develop into an infection? Do I have to change my life? Do I have to get an operation? I mean, what does it mean?
Good questions, and we are coming to all of these. So diverticulosis is a common problem. A lot of Americans have it. It's mostly in the Western societies and the Western part of the world where we see these more commonly. And diverticulosis is also related to age and genetics. So above the age of 50 and 60, about 50 to 60% of the population may have some pockets. And at the age of 80, some estimates say up to 80% of patients or people can have pockets in their colon. But that doesn't mean that all of them are going to have problems. Majority of them, 75-80% of the patients don't have anything. They don't even know they have osis or itis or any other pockets or pouches. They're not having a pouch party yet.
Like, explain this pouch party to me.
So a pouch party is when you invite some people and bad actors come in and destroy the party and you get an infection.
So if I have diverticulosis, I have pockets going on, and then if I introduce maybe the wrong types of foods or don't treat my body right, then I'm prone to getting infection.
And that is when the infection comes in. It makes a little hole in the colon, and that hole causes the food and poop and bacteria to leak out, and that causes noise, and then the cops got to come in and bust the party.
So I should be maybe not so concerned if I'm diagnosed with diverticulosis, but maybe there's some lifestyle changes I have to make, or, I mean, it sounds pretty scary, honestly.
It is very scary, very, very scary. Anytime you have any diagnosis or any label, you should be very scared, okay? It's not easy. Being a human, we're gonna be labeled multiple things.
Right.
Don't be afraid though. Diverticulosis is a benign problem. That does not mean that you're sick, you're dying. You may live to 100 or plus, hopefully. What you need to do is improve your diet. So diverticulosis is common in the Western world, like I told you, because we have noticed that the people in the Western countries, like America and Europe, etc., do not eat a lot of fiber. See, I was going to bring up fiber, see? It's all related to your gut. So
you are what you eat.
Exactly. Lack of fiber causes the bacteria to grow that are not good. These are the bad actors. And then you get a pouch party, which is not good.
So if you eat pouches, you get pouches.
What kind of
I'm
pouch?
just kidding.
Yes, so food out of a pouch is a pouch. So you don't want to get pouches. So the good part is that if you eat food that grows on trees and plants and sometimes animals, then you're okay. But if you put it in a box, in a pouch, wrap it up, you're probably eating processed foods. And less of that, more wholesome, natural foods. So in countries where people don't have high-tech machinery and pouches and pizza boxes and McDonald's and all these things, they actually live longer and they have healthier gut, and their colon has less diverticulosis and they have less diverticulitis attacks.
I'm curious what country has the most prevalence of diverticulosis. Sounds like you're willing to bet it's the US.
Well, U.S. is one of the most modern countries, but other countries are also in that range. I'll have to really look
Someone
into
Google
the
it
data.
for me.
Yes, Google that for us, please. Which country is the worst offender here?
Now, is this a more recently developed disease, or is it something that's been around for a long time?
We have noticed pockets and pouches in cadavers of all nations all over the world, but what we have found is that in parts of the world where food is processed, these pouches become worse because what happens is that when you don't eat a lot of fiber, your colon has to work a lot more. And when it has to work a lot more, it has to push a lot more. And when it pushes a lot more, the weaknesses in the colon, and there are many, the pockets can pop out. And that's what happens.
So there can be more prone areas of the colon to develop pockets.
Correct.
Based on its function.
Based on its function, and that's why the majority of them can be on the left side where we have some anatomic problems, some issues that can aggravate this or make the diverticulosis and diverticulitis worse.
Mm-hmm. So I feel pain in my left side. When I run to the doctor and tell them I have diverticulosis.
Or diverticulitis, yes. So it depends on many things. Okay, as I said, diverticulosis and diverticulitis is a disease of the 50s and 60s and 70s when your colon has been alive for a while, and then you're not eating a lot of good food, and then these pockets start to bulge. We see them in the younger population sometimes, and sometimes families genetically have pockets on the right side or something.
You mentioned genetics, so I was wondering, is that something that you have to get tested for, or do you just wait and see and then list it on your medical history, or?
So diverticulosis is very common, as I said. Majority of the people in their 50s and 60s will start to see some. So if you have a colonoscopy, you will see some pockets, or your doctor may tell you about it.
Mm-hmm.
Don't panic, don't worry. All you have to do is add more fiber. Okay, better food, you're gonna live longer and your colon is gonna be okay. And talking about fiber, you also have to know that probiotics also play a role, and we have found out recently that a lot of disease happens because we don't eat good. And if we don't add prebiotic fibers and probiotics into our life, into our food, then these problems like diverticulosis and other issues can happen.
Does it cause any other problems?
So diverticular disease is also related to gastrointestinal bleeding. And we see sometimes patients come in with blood in their poop. And this mostly happens to elderly patients, and they have a bowel movement and suddenly they have a lot of blood coming out. So sometimes it's hemorrhoids and sometimes it is something else. And diverticular disease can sometimes cause massive bleeding, causing admission to the hospital and further testing and possible surgery and or serious complications, including death. Yes. So don't take this lightly. Diverticular disease has treatments. We have to talk about some of that and get our patients better by prevention. So prevention is better than cure. So in your 50s and 60s, start to eat better, guys. Your mom, your grandma, they all talk about eating more veggies, more fruits.
Because they have good fibers.
Yes, good fibers are very important for you.
Mm-hmm. How can you tell by maybe looking at your bowel movements to see if you're eating healthy?
So if it floats, then that's good bowel movement. If it sinks, we find that carnivores and animals and humans that eat a lot of meat, their poop just sinks down. And herbivores, their poop has more floatage and more ability to stay afloat.
You're laughing at yourself.
Yeah, because I just made up a word called floatage.
Someone Google that also. I want to know. Floatage. We'll look it up later.
So when they have done poop analysis, they find out that the Herbivores have better bacteria, and those bacteria are the ones that help improve our lining of our digestive system, including the colon. So,
softer poop with more floatage
is a better idea. Well, write it down. Floatage. That's the word of the
day.
Word of the day is floatage. Floatage. Floatage.
That's how I spelled it.
I think so. That would be nice. So you were talking about abdominal pain. You know, you were asking me what would I do if I have pain. So when you have pain like this, and what you need to do is, after you've Googled, because everybody's going to Google and now they're going to do
floatage.
Not floatage. They're going to do the chat thing, you know.
Oh, Chat GPT.
Chat GPT. Bing bada bing.
No.
Okay, yes. So after you have searched the internet and asked all AI bots out there, see a human being, a provider, a doctor, a physician, a nurse practitioner who may be able to help diagnose if you have a serious condition like diverticulosis or diverticulitis. So when you have pain, you are having discomfort, bloating, gassiness, fever, you cannot move or you get very sick, time to call in the troops and get checked out.
Okay, makes sense. You don't ever want to ignore problems, especially digestive issues, because that's a major part of your health.
Correct. And when you look at the box from here to there, you know, from here to below, this is the area where all the digestion is mostly happening after the mouth and going through the gullet. And in this part is a mysterious organ, or it's called the digestive system. Okay. And this makes amazing food like sushi, pizza, cauliflower, apples, mangoes, peanuts, anything you can eat. It all comes out brown and composted and smells and is poop. So your body is able to take all the energy, all the nutrients, all the good stuff that make us who we are, and it dumps out something called poop, and that is what it's all about. Eating and living. And pooping.
So
sorry, I'm just making it up, but it's true.
It's funny, I had a patient today and I was discussing similar topic, and he's like, well, I wouldn't have put it that way, but so
well, we're trying to put it that way. We're trying to say the simple things. You know, DaBootyDoc Talk is about the booty. It's about your bum. It's about your bottom. It's about taking care of your gastrointestinal and colonic health. And I mean, we may make a joke about it and may make it simple and easy for layman terminology purposes, but the goal is to make sure that people can hear us and some way improve their diet. Because if you eat better and eat more fiber, then you are going to live longer. Simple as that. And better.
So if I develop pockets in my colon, will they heal? Can they shrivel up and patch themselves back together or put a button on it?
Good point. So our bodies are able to heal. So when you have diverticulitis and you have a hole in the colon and bacteria and poop are leaking out, your body is able to close it up and button it up, and that can be sealed instantly or may take a couple of days, and you may develop a little cap around it called an abscess. So an abscess is a collection of pus. Sometimes the hole is bigger and you can't control it, and poop starts to leak out more. It may start to go inside the outside the colon, and you may develop peritonitis. You may also leak out air, which may go inside the belly and make you very bloated, and you may get very sick. And sometimes that can cause very serious injury.
So, but an abscess doesn't sound like it's healing. An abscess sounds like a infection.
Yes, so when you get an infection like that, that would require you to go to a hospital, emergency room. At that point, the physician is going to examine you, take a detailed history, maybe do an abdominal x-ray, maybe do a CAT scan, And if you have an abscess, if you have infection or something serious, they might admit you in the hospital. And if you're not that sick, if your abscess is very small or you just have minor inflammation, they may start you on antibiotics and have you go home. And that may vary.
So say I get a dose of antibiotics, I'm on day 10, I'm finishing up the batch. Am I still gonna have pouches? Are they gonna be shriveled up and disappeared? What are my outcomes?
Good question. When you talk about diverticular disease turning into diverticulitis and you have been started on outpatient therapy, meaning you have gone home with a dose of oral antibiotics and your doctor has hopefully told you to do bowel rest, that's also very important. And I'll talk about that. Then after 10-15 days, your colon is going to heal up that area slowly. And you may be able to start your diet back and slowly get back to normal. And those pockets don't shrivel up, but they remain there. So you're at a risk of having problems again unless you change your behavior and your diet and invite fiber and probiotics to the party.
The good guys.
The good guys.
So pockets never really, once it develops to that stage, you're kind of dealing with something that you need to maintain.
Correct. So this is a very important part because if you are in your 30s and 40s and if you're taking care of your digestive health and you're eating better fiber, your chances of getting diverticular disease may be less. So that's why in the 50s and 60s, those people have not been eating well all their lives and now they're getting problems. So in the 50s and 60s and 70s, your fiber intake goes down already, so your chances of having problems go up.
I see.
So prevention is better than cure. So please work on that. Eat more fiber. I'm saying it again and again at this meeting. I always do.
It's true. If you come as our patient, you're getting fiber materials. That's
for
sure.
We talk about fiber to almost everybody. I think fiber is very important. My favorite fiber is flaxseed fiber. You have this magic pixie dust that you can get at Publix.
I had some today with my yogurt, honey, and strawberries with blueberries too.
You can get it in any grocery store. You sprinkle some of this magic pixie dust onto your food, and that will give you extra fiber that will be healthy for you. So
and it's key. He's talking about the pixie dust. So what he means is ground flaxseed.
Ground flaxseed.
So maybe you're like, oh, I got some flaxseed right here. But it must be ground or you're gonna poop it right back out like a watermelon seed.
Or an orange seed or seeds like that. They don't work. So
you can't digest it, you can't break it down. So if you do have whole flax seeds, then you can grind them up yourself too. So it'll still be useful. But yeah, you can find ground flaxseed and there's golden flaxseed, there's
brown flaxseed,
but it doesn't matter, same. So I get mine from Publix, but I've seen it at all sorts of food stores. I bought it online too, like during the pandemic, I was getting it off Amazon, so you can easily find a brand.
Yes, and so talking about diverticulitis, okay, diverticulitis can be very serious also. We have all heard about grandmas and patients getting a colostomy urgently and sometimes not making it and passing away. That can happen. In a lot of countries, we don't have healthcare that quickly. During the pandemic, a lot of patients were not able to go to the hospitals, and we had some incidences where these colons bursted, opened up air, and leaked out poop, and the patients were not able to make it. So we have to be able to get them to the hospitals, get them operated on, clean up the area, maybe give them a colostomy, maybe fix them back, depending on their situation, and then help them recover.
And a colostomy is basically an external redirection of your colon.
Of your colon, so you can poop out of there instead of your body. So you've seen
maybe people having a bag on their body before, and you're wondering what that's for. Well, it's the end of their colon, and it's their little pouch to collect their fecal matter. So.
Yes.
So that's a colostomy. Another option too, a more serious surgery would be a colectomy, right?
A colectomy, and sometimes you can do a washout, meaning that you can go inside and wash the colon out, and if it's not so bad, you can keep it, stay attached, or you may take it out and reattach it at the same time or later. So there are many tools in the toolbox that the surgeon has. But before you get to the surgeon, before you're there, you need to be able to, be better. So what I'm trying to say is that don't get there. Eat better food, take care of your health, get regular checkups, get a colonoscopy at age 45 and above, eat better food, more fiber, add more probiotics.
It's important to mention too that, getting a colonoscopy, we always talk about colon cancer, but colonoscopy can be diagnostic for many other things too. So even if you're thinking, I don't have cancer, no one in my family has cancer, you might have other digestive issues or things that you don't even realize yet. So one of my patients today even said, he had a colonoscopy prior, years and years ago, and at that time he was told he had the onset of diverticulosis. So that was one of his questions, and it just happened we're talking about this discussion today.
Oh wow!
But
okay.
But he said he had some pockets that were noticed, so he's curious on this colonoscopy I scheduled for him today if he'll have any further, whether it's maintained or is it worse.
So there's a chance that he might have a progression if he's not eating more fiber. So the message remains the same. Add more fiber, both soluble and insoluble fiber, which comes from fruits, vegetables, roughage, plant material. Mm-hmm. So when you start to digest and ingest fibrous products, they are very healthy for your colon, where they ferment and they can heal your colon. They can give food to the colon, which can allow problems like diverticulosis to not get worse, or they can cause diverticulosis to not turn to diverticulitis.
And eating plant fibers is critical, in addition to maybe you're like, oh, well, I take my fiber supplement every day. But fiber supplements don't always have both soluble and insoluble fiber. How I describe the two is that the soluble fiber is feeding your good gut bacteria. The insoluble fiber is brushing your colon. So you need both to do different things. So a lot of these like fiber oils or capsules, they might not have what you need in terms of insoluble fiber. So
I tell patients, eat carrots.
Whole, just swallow.
What's up, doc? Bugs Bunny was right about it. Carrots have fiber, they're healthy for you, so that's one thing I tell people. The other thing I wanted to quickly bring it up, there's a myth that popcorns and nuts are bad, and you shouldn't eat them when you have diverticulitis.
Because you're thinking packets, you might get something stuck in there, right?
Correct. So when you have diverticulitis and your colon is inflamed, because itis means inflammation, at that time you should give your colon a rest. So when you were talking the 10-day period of antibiotics, at that point you want the human being, the patient, to not eat too much. Rest your bowels. Don't have too many bowel movements. Don't eat a lot.
So I can drink milkshakes for like a week?
No, you just drink liquids that are clear. You don't eat a lot. You can have soup broth. You may have some rice. You may have some low residue, low fiber food that you need, so that your bowel gets to rest. And rest is so important, guys. A bowel rest means that you have almost like a fast. You don't activate the different systems in your colon to start churning and working at the same time when your factory is not working. Mm-hmm. Shut down the factory for a couple of days.
That's a good way to put it.
And let it heal.
Yeah.
You'll be okay.
So if you are having abdominal pain, especially in the left side, it might be related to diverticulosis.
It could also be other things. I mean, last time we talked about IBS, which is irritable bowel syndrome. So these are all fancy things, but don't get too bogged down. See a doctor, see a provider, see a specialist, see somebody who can help you. Guys, These are all good things. We have touched on many things today.
If you have
Excited to be here.
questions, let us know. We're kind of wrapping up our show here. It's almost 7:30 now. Goes
The
very
Booty
quick.
Doc and Sydney Farooq, Shiraz Farooq and Sydney Farooq, we're here.
Yeah,
Thanking you guys for listening to us.
yeah.
God
Thanks for everyone
bless.
that joined.
And
We'll update you about what we'll be talking about next week. So look out on our social media on Monday. We usually post our topic.
yeah.
If you have any suggestions, I'm curious to hear. Or if you have any further questions about today, just let us know.
The Booty Doc is here, guys. Take care. Thank you very much. See ya. Thank you.